overuse of antibiotics, especially as a child, basically sets the stage for people to have gut dysfunction and things like autoimmunity later in life. And so that's one of the first questions we often ask when we are treating patients or working with patients with gut issues is, did you have a history of antibiotic use as a child? And most often we did, right? That was just, if you grew up in the 70s, 80s, 90s, when these things started coming out, it was kind of like, oh, just take this, just take this, just take this. And it was prescribed as kind of like this magic pill without the thought of like what's coming later on. And so other things like glyphosate and pesticides, which are basically antimicrobials, they can damage the gut as well. And these are all over food and within food that we're consuming on a daily basis. Processed food and seed oils feed the bad bacteria. So they actually are like fuel for those pathogenic bacteria if those are present. And then chronic stress, which can reduce our vagal tone from the vagus nerve. If you don't know what the vagus nerve is, go back and listen to the episode a few weeks back where we talked all about vagal tone and how that can influence health and our body's ability to recover. And so chronic stress reduces that vagal tone, which can slow the motility of our gut and basically shift the bacterial balance towards more of a negative than a positive. And so there was a 2017 study done in Frontiers in Microbiology that showed stress alone can shift your microbiome composition within 24 hours. And so they also show that one poor night's sleep can really overstress the gut and lead to this kind of dysfunction within 24 hours or within the next day. And so your gut is really like, think of it like ground zero for your health. If you ignore it, you're setting yourself up for things like IBS, depression, thyroid disease, autoimmunity, even like dementia later in life, because it is, again, the first line of defense for your immune system, your body's healing.